Yep, so today we're starting basically to discuss answers to that practice test that was posted on the school box, which was only for chapter 11. So hopefully you guys had a chance to try that out. So going through the questions, so the first question was multiple choice. Mental disorder is best described as, and obviously you can correct your own paper if you've already done this, and the answer will be D. So it's a diagnosable psychological condition that affects how a person thinks, feels, and behaves. Okay, the others are not accurate descriptions of what a mental disorder is. Then you've got question 2. So question 2, which of the following individuals is most likely experiencing a significant mental health problem? And your best answer there will be A, because A suggests that there are some changes in mood and motivation, but the person is still productive. They're still getting to work each day. So there's an indication there that that person isn't experiencing from a mental disorder and would be more likely to be experiencing a mental health problem. Okay, so moving on to the next multiple choice. So which of the following is a psychological factor that could contribute to the development of a mental disorder? So again, psychological factors are related to ourselves, internal things, like our feelings and our thoughts and our emotions and that kind of stuff. So if we, through a process of elimination, you would come to this idea that it is D, because how we perceive our internal and external environments is related to how we judge. Okay, our judgments are an internal thing, because how you judge something comes from within you as a person. Okay, not having enough money for the basic essentials of everyday life is kind of connected to income and socioeconomic status, so that is more of a social factor rather than a psychological factor. And obviously gender is biological, being bullied by someone at school is also social. So the best answer there for psychological is D. Which of the following is not a biological factor that could contribute to the development of a mental disorder? So which of the following is not a biological factor is the key idea here. So the best answer should be A, because all the rest of them are related to your body functioning or can directly affect your body functioning. Okay, so low self-esteem is more of a psychological factor rather than a biological one. So that's why the best answer is A. Okay, moving along. So question 5, a mentally healthy person with a high level of functioning. So this is looking at the characteristics of mentally healthy people. So what does a high level of functioning mean? The best answer for this should be B, because someone who is mentally healthy, and specifically someone with a high level of functioning, we talked about them having higher levels of extracurricular activity participation. So they're more likely to maybe be in some kind of extracurricular activity at school, like maybe debating or some leadership team or SRC or that kind of stuff. So or even some sports team, anything like that. Like they do things outside of school. And they also, at the same time, they also participate fully in school activities as well. Okay, so whether it's leisure or school, they're pretty active participants. So that's why the best answer is B. Question 6, the biopsychosocial model would account for mental health or the development of a mental health problem or disorder by explaining. And there's a key word here that we need to look out for. And that key word here is interaction. Okay, so the best answer here should be B, because it says the interaction of biological, psychological, and social factors. And remember, I think yesterday or day before, I was saying that whenever we talk about the biopsychosocial model, the word interaction and the word holistic are kind of key words connected to that model. So if you're ever asked to give a definition of them, of the word biopsychosocial model, you should be including those two key words in that definition. Alrighty, so moving on with our multiple choice. The next one is question 7. So before any psychological research with human participants can be conducted, the researcher must, and you've got some options there, and the best answer is D, so obtain written approval from the ethics committee. Now this is just connected to research with mental health participants and that kind of stuff. Question 8, so Penelope's growing dependency on coffee and wine to help cope with her anxiety and sleeping issues suggests that in relation to the mental health continuum, and your best answer here will be C, because we can't say that Penelope has a mental disorder. There's not enough in that scenario to say that she's actually got a mental disorder. There's also not enough in the scenario to say that she's mentally healthy, okay? And because obviously we can't say she has a high sense of well-being if she's quite dependent on coffee and wine to cope with her anxiety. So she's using other things rather than her own stress coping mechanisms there. Penelope's normal is really vague, so By a process of elimination, our best answer would be C. Question 9, so OM has developed satisfying interpersonal relationships with a diverse range of people, which makes her feel good about herself. It is likely that OM has a something level of something well-being. So obviously when we're talking about interpersonal relationships, those are the relationships that people have between each other. So that's basically how we interact with those around us. And we know that interpersonal relationships would be best connected to social well-being, and that if you've got good interpersonal relationships like OM, you would have a high level of social well-being. So that would be your best answer there. Whoops. Yep, your best answer would be D. And then question 10 is, which of the following reasons best explains why a placebo treatment is likely to be of ethical concern? So now we're talking about the ethical implications associated with placebo treatments when used in an experiment to test a new drug for a mental disorder. So in this case, this was actually kind of like a tricky question because there are two options that students are most likely to get confused with. The best answer would be C. And the reason that the best answer is C and not D is because when we're talking about a placebo treatment, placebo treatments are never given to people in the experimental group. They're always given to people in the control group, okay? Because a placebo treatment is simply supposed to act like a baseline for comparison, okay? So if you've got a bunch of participants in the experimental group who are taking an antidepressant, the placebo is something that resembles an antidepressant that doesn't have any actual drug or active ingredient in it. So obviously the control group takes that because they act as a baseline of comparison. Okay, experimental group don't even need to be taking a placebo. They need to be taking the proper drug or the proper experimental treatment. So that's why the best answer is C. And this is kind of a confusing one because if you're like in your exam situation or in a SAC and you're just trying to do this in a rush and you don't even read which group is mentioned in each of the options C and D and you just see exposed to harm, you just automatically circle option D or color in the bubble for option D, which would eventually lead to you getting that question wrong. So it's always important to, even though you want to get multiple choice done in a rush and get through to the next section, it is important to read the multiple choice properly because it is easy to get tricked and to get misled by what a multiple choice, especially when the options are quite similar as well. Okay, so those were the multiple choice questions. So now we're moving on to the short answer questions. So the first question was 1 mark and it was outline the purpose of the mental health continuum. So basically you're trying to briefly describe what is the point of the mental health continuum. So obviously your best answer would be talking something along the lines of saying that the mental health continuum shows that our mental states are ever changing, that they're never still or stationary, that they're never in a static state. So you just need to mention 1 or 2 of those keywords there. So either ever changing or ever fluctuating, ever transitioning from one state to the other. All of those are fine and acceptable. Again, it's not enough for you to simply list down the 3 mental states, but it's important for you to explain how the mental health continuum represents those states, okay? The mental health continuum indicates that we can shift between those states in our lives. We can change between those different mental states at any point in our life. Now, an example is not required here, and you don't even have to talk about the 3 mental states, as I mentioned, because the question is only worth 1 mark. Okay, so because it's only worth 1 mark, you don't have to go into further depth. And I think it's important that we start to look at the marking allocation, look at the amount of space given before answering questions. Because if a question is worth 1 mark and you spend 5 minutes on it, you're really taking away time from the other questions that might require that time, okay? And time obviously is very valuable in a SAC or exam situation. Okay, so next question is question 2. So question 2A was describe what is meant by resilience. So that is a simple definition, the ability to cope with life stresses and eventually restore yourself to a state of positive mental functioning. So ability to cope with stresses or adapt to stresses is half a mark there. Eventually restoring positive mental functioning is the other half mark. So if you mentioned 1 but didn't mention the other, you'd probably get 0.5 marks for this one. Now, obviously, in a VCA exam situation, if they asked you to describe what is meant by resilience with reference to an example, you would then probably see this question being worth maybe 2 or even 3 marks. The next part of the question is briefly explain how having a high level of resilience would promote mental health. So now you're not just defining the term, but you're actually taking that term and you're actually trying to unpack it and you're trying to link it back to, okay, how does it actually promote mental health? So you don't have to do it like in extreme detail because again, it's only worth 1 mark, but just a brief link between resilience and mental health is what is required here. So I've just written, having a high level of resilience would allow a person to adapt to their situation and cope with stress more effectively, which would promote mental health. Now we know that one of the definitions of mental health, one of the components of the definition of mental health is the ability to cope effectively with stress. Okay, it's a state of well-being in which a person realizes his or her abilities, can cope effectively with stress, can work productively and fruitfully, and can make a contribution to their community. So we've got one of those components talking about coping with stress. So making that link between one of the components in our mental health definition and connecting it back to how somebody with resilience would show that particular characteristic. Okay, that's all we have to do in this question here. Okay, so that's basically looking at question 2. Then we've got question 3 and 4, which were really easy questions, easy peasy. Question 3 is name any one characteristic of a mentally healthy person, and we've got specific ones. So, you can choose any one there. You can choose high levels of functioning, social well-being, emotional well-being, resilience to life stresses. All that stuff would get you the mark, and all you've got to do is just name it, because that's what the question asks us to do. And in addition to that, it's only worth 1 mark.
Miss?
Yeah.
How about if you did not name those, but you kind of gave it in a more, like I said, a mentally healthy person is able to set goals for themselves and strive to achieve them. So would that count, or do you have to state it in that way?
See, what you just talked about is actually a concept called self-efficacy, but we don't learn about self-efficacy this year because it's been removed for your adjusted study design. Because it said name, it's more assessing your knowledge of key terms. But I think that from a VCA point of view, they would still accept it, because in last year's exam, they had a similar question to this one, and they expected the ones that are on the screen, but they also accepted like other ones like self-efficacy, reaching goals, like what you said. They also accepted, effective coping mechanisms for stress. They accepted other ones that were not just the ones that we learned about in chapter 11. So I would say that you'd still get the mark for that, but you would have to have called it self-efficacy or high self-efficacy or something like that. But, yeah, I think that would be okay. It would slide through. Yeah. Okay, so question 4 is classify the following factors below by writing the factor under the relevant box. So you've got all the different factors here, and then you had a box. So I'll just show you what that box looked like. Okay, so according to classifying these, according to biopsycho and social, genetics would come under biological, obviously. Substance use, because it directly affects your brain, comes under biological. And because we skipped chapter 12, a lot of you will find this a bit confusing, because we learn about substance use in chapter 12. When people take things like cannabis or, or marijuana, essentially what happens is that it does actually affect their brain. And it can actually lead to things like psychosis. It can actually lead to drug-induced onset of schizophrenia. So substance use is a biological factor simply because it directly affects brain chemistry and brain functioning. Okay, so that's why it's a biological factor. Psychological factors, pretty straightforward. Overthinking, coping skills for stress are obviously internal and influenced by who you are and what you do. Social factors are things like from outside, like income levels is dependent on what kind of a job you have, what access to employment options you have. So that's from outside of the person, so that's why it's an external factor. And access to healthcare services is also a social factor, because the amount of hospitals or doctors' clinics or anything else, mental health services you have in within your reach is dependent on the kind of society, on the kind of suburb, on the kind of social environment you're living in. So that's why access to healthcare services comes under social factors. And these are just examples of biopsycho and social factors as per our biopsychosocial model. Okay, so that's simply just putting the correct factor into the correct box, and not too difficult, I think. Okay, and then the next question is a little bit more extensive. It's looking at a case study. So it says, Stan is an elderly man who was diagnosed with depression in his early 20s. He has tried numerous antidepressant medications over the years and continues to use them despite his belief that they have not cured me. Stan has been asked to participate in research on a new drug for depression that has been trialed with animals and has since been approved for human trials. The study involves hospitalization for a 4-week period during which Stan must not take any medication at all. Volunteer participants will then be assigned to either an experimental group who will be given the new drug or a control group who will be given a placebo treatment. Stan agrees to participate in the study, commenting that, "I don't care anymore. I don't care if I get the medicine or the placebo. What difference does it make anyway?" So then it says, outline one risk of involving Stan in the specified mental health research study with reference to Stan's scenario. So we're linking back to Stan in our answer here, and we are linking back to the ethical implications in the use of placebo. So we have to talk about how Stan being exposed to a possible placebo in this study could have ethical implications in terms of his safety or his well-being. Okay, so I'll just show you guys the sample answer, and it's worth 2 marks, so it's not worth a whole lot, but you do have to mention some key ideas here. The first key idea you have to mention is that obviously if Stan is receiving the placebo treatment, that means he'd be in the control group, and in order to receive the placebo treatment, he'd have to stop taking his usual antidepressant medications. And in the case study, I think it was there somewhere in the case study, that he actually has to stop taking his medications. So it says not take any medication at all. Okay, so there's some indication there that Stan will have to stop his usual antidepressant medications there. And that's 1 mark. Now, the other 1 mark comes from you talking about the fact that because the placebo that Stan is being asked to take contains no active drug in it, contains no active drug or antidepressant substance there, one risk or one ethical implication could be that Stan's depressive symptoms actually become more severe or intense in the absence of that antidepressant that he would normally take. And because his depressive symptoms are becoming worse and more severe, his overall well-being and his overall welfare is actually being affected as a result of that. Okay, so essentially that's where the 2 marks comes from. Number 1, talking about, first of all, what is the point of the placebo treatment and what is the implication of that for his current medication practices. And number 2, linking that to how it's going to exacerbate or worsen his current depression and the depressive symptoms he might experience. Okay, so that's basically where your 2 marks will come from. Cool. So then we'll move on to the next question. And the next question is, Lisa is 47 years old and has had autism from a young age. Lisa has been invited to participate in a new study, which is trialing a community intervention program for those with autism. Outline why informed consent procedures would be of particular ethical concern for mental health patients such as Lisa, who are to be used for the purpose of mental health research. So this is just a question looking at the second ethical implication we covered in chapter 11, which was the informed consent procedures. So this is also worth 2 marks. So basically what you're talking about is, number 1, you're going to be linking back to Lisa because it is a scenario-based question. So we do have to use her name. Probably good to also mention what kind of a mental, kind of intellectual disorder she has. So first of all, you should mention that, okay, Lisa has autism, and now autism is a mental disorder which does severely impact cognitive functioning. And what that means is that Lisa might experience an impairment. Okay, she might not be able to make decisions in the same healthy patients do. She might not be able to process information in the same way that mentally healthy patients do. Okay, and because of these cognitive impairments that she has compared to the mentally healthy population, she might not be able to fully understand what she's signing up to. So she's kind of putting her name on something, but then there's a risk that she's not actually fully understanding what she is subscribing herself to. Okay, so for this reason, patients such as Lisa may be unable to give full informed consent. And obviously, that is one of the ethical implications of that. Yeah, they're signing a paper, they're saying that they've read it, but do they really understand it? And when they've got cognitive impairments, we can't really assume that they have understood it. We have to kind of assume that they haven't, and, you know, pursue other pathways for Lisa, like maybe asking Lisa's guardian to come in, maybe asking Lisa's partner to come in and give informed consent, or her psychologist or her doctor, someone who can give consent on Lisa's behalf who is someone that, you know, Lisa can trust as well. Okay, so that's basically talking about informed consent procedures and the ethical implications associated with them. Alrighty, and then we've got Milos is the next question. So we've got question 5 is a case study. So 3 months ago, 45-year-old Milos lost his job at a company where he had worked for 25 years. He's still unemployed despite applying for many jobs. He's got 2 teenage children living at home. His wife works full-time as a teacher. He goes for a run every morning, maintains a healthy diet, so that's looking good. Before losing his job, Milos had promised to take his family for an overseas holiday for Christmas. He feels anxious about whether he'll be able to keep his promise. Milos is having difficulty sleeping and often goes to bed stressing and thinking about things that could go wrong. How things could become worse in the future. Last week, Milos made contact with a job agency that provides him with job application and interview skills so he can get a job as soon as possible. And then the question is Milos experiencing a mental disorder? Justify your response with information from the scenario. So obviously you get a mark here for saying yes or no. So yes, he's experiencing mental disorder, or no, he's not experiencing. So I don't know what you guys wrote, but the answer should be that he's not experiencing a mental disorder. And I'll tell you why he's not experiencing a mental disorder here. Remember when we talked about mental disorders, when we talked about someone experiencing a mental disorder, we used that memory tip iPad. Yeah, we talked about some level of impairment. We talked about some level of personal distress. We talk about some atypical thoughts, feelings, or behaviors. And we talk about dysfunction, not being able to function normally. One of the reasons, there are many reasons why Milos doesn't have a mental disorder, but one of the reasons is that he's trying to be productive. He's still practicing self-care. Self-care means he's still going for a run every morning. He's trying to look after his physical fitness. He's still eating a healthy diet. And remember, adequate diet is one of our key factors of mental health that we learned about in chapter 14. He is still making contact with a job agency. Okay, he's still trying to get a job. He still has that hope that he will be able to get a job in the future if he just brushes up on his application and interview skills. So there's a lot in this scenario that tells us that Milos is not dysfunctional and that he's not really suffering a level of impairment that is enough to qualify him for a mental disorder diagnosis. He is experiencing a little bit of personal distress, okay? And we do see that in, where did I highlight that before? Here. So we did see that in the scenario. So he is experiencing a little bit of personal distress, but it hasn't really come to the point where it's affecting his ability to function as a normal person. It's not affecting his ability to look after his family or to be a good father or a good husband or a good, good person, okay? He's still able to fulfill those roles and he's still able to work productively. So that's why, even though he's got a tiny bit of stress and anxiety, as we see in the scenario, these are more indicative of probably a temporary mental health problem rather than an actual clinically diagnosable mental disorder. So for that reason, I say no. I get 1 mark for that and 1 mark for justifying why, which is basically what I wrote in the red here. Okay, so you don't even need to mention multiple reasons. Just mention one reason why you think he's not experiencing a mental disorder, and that should be more than enough. This is just to show you the range of options or range of answers that could be there. Cool. And it's very important that, you get into this idea of reading a case study and making a judgment of whether a person is experiencing a mental disorder or not, because these are really common types of questions with this outcome. So remember, whenever you get a case study, the main tip, write the word iPad next to the case study and then go through it step by step. If the person is experiencing dysfunction, not functioning normally, not going to school, not going to work, staying in bed all day, cutting off contact with friends, or some level of impairment, like they're not able to function independently, other people are doing their things for them, all that kind of stuff. Some level of impairment, like not even showering because they just don't see the point, completely abandoning self-care. Okay, those are indications that a person does have a mental disorder. So be really critical when you're analyzing these kinds of case studies, because even a little word or a little sentence in the case study can give you a clue as to what that person is experiencing. Okay. So it's the same case study, but now we're describing any two biological, psychological, and or social factors reflected in Milo's scenario and classify each of them as being either internal or external. So this is a question where it's really important for you to read the question properly, because the question says any two biological, psychological, and or. So this doesn't mean you have to name two biological, two psychological, and two social. No, that's not what it means. It means that from the biological, psychological, and social, you choose any two. So in my answer, I could decide to do one biological and one social, or one psychological and one social, or one social and one biological. Okay, it's just basically telling you that you can pick between any two of those particular factors. Okay, so that's basically, and the second part of the question is classifying that as being either internal or external. So I'll just show you guys the sample response. So I've just written, in Milo's scenario, him losing his job at the company he worked at for 25 years is an example of an external social factor, okay? And furthermore, Milo's overthinking about how things could become worse in the future is an example of an internal psychological factor. That's about it, okay? We know most social factors are external in nature. We know most psychological factors are internal in nature. So that's basically where your marks comes from, okay? 1 mark for classifying external and internal correctly, 1 mark for linking the specific factor to the scenario. Okay, so that's basically what we're doing this now. The reason we haven't just listed it out is because the question asks us to describe, okay? And in most cases, unless the question asks you to list something, you shouldn't really be listing things out in dot points like this, okay? Unless it actually asks you to list, it's always better to give a really brief description. It doesn't have to be an essay, but writing in proper sentences is always good practice. Alrighty, oh, that brings us to the end of the test. Oh, that's good. Okay, that didn't take as long as I expected. Cool, so I'm just gonna stop the recording here.